assessment failed to relieve the symptoms. And the dose is 1 to 2 milligram per kg. So normally we give about 30 milligrams to about 40 milligram max. Some people do give up to 60, very rare. And of course, for children, only for the very bad recurrent asthmatics, poorly controlled, the dose should not be excessive. Okay, and I just learned from Prof. Che, we hardly give more than 30 for children. Okay, and you will advise them to use steroid, okay, and especially if they start to wheeze and progressively worsen after the onset of exacerbation, the patients are advised to consult the doctor. This is not in place of consultation, but at least they can do something for themselves, maybe in the middle of the night when they have the exacerbation. And if they are not well, they are advised to see the family physician, their family doctors. On the other hand, if your patient's symptoms improve or even completely resolve, then of course they can step down to the green zones. It's just like the traffic light changing colors. So the step down can be done after about 2 to 4 weeks. It depends on your patient's response to the medication. And of course, the peak flow monitoring is another guide to see whether the patient is able to step down to the green zone. What happens at the red zone? Okay, of course, red means danger. You have to inform and educate the patient when and how to seek immediate medical attention when an asthma attack is severe, and you can see all the symptoms stated there. It is important to note that when recommended doses of inhaled medications do not provide rapid relief, that means if they need to use the blue inhaler less than 4 hourly, means within 4 hours you after the use of the Ventolin you still feel very breathless, then I think you should seek medical attention as soon as possible. And in most WAP we always list the emergency phone number. When you panic, you will forget even the emergency number, so you all have it down and in the ward. I have one patient who even forget the handphone number when she had a bad attack. So I think it is important that we give all the relevant information to the patient and it's there on the ward. So what do you advise the patient? If you develop a severe attack, okay, and you refer to the list of symptoms on the ward, please call the ambulance or go to the nearest doctor immediately. While waiting for the ambulance or on your way to the clinic, you can also use the asthma medication as listed. You can use it more frequently while you're waiting for help. How about the other asthma medications? Of course, you can also have inhaled Atrovan or Formoterol as alternative to salbutamol. And of course, some people do use Briconel or Terbutaline as substitute for Ventolin. And some people do use oral theophylline as well as Singulair. Okay, at the bottom of the WAP, okay, you may want to talk about, we may want to add in the peak flow range. Normally for green zone, it is above 80% your baseline peak flow, and for yellow up to 60%, and below that you have to seek immediate medical attention. And for continuity of care, it is always advisable to put your name and contact, because you are, after all, they are family doctors. So if the patients are in doubt, they can always contact you for clarification. And the date of prescription of the WAP, it will give you an idea when you have last reviewed your patient's medications, and it is always advisable to review and revise the WAP periodically, especially when a patient's control is suboptimal. Okay, so but of course, above all, it's very important to put your patient's identity on the WAP. We have advised some of these patients to even bring a copy, because they can always photocopy their WAP, especially for students, and pass it on to the teachers, so that at least the teachers know what to do when they develop asthma exacerbation in school. So this is one of the use that you can think about. So which patients do you prescribe WAP, and when do you do it? Okay, can be given to any asthma patients. Of course, the evidence is not very strong for those with intermittent asthma, but we do also give to them because we also encounter patients who forget to use Ventolin even with wheezing. So no harm if you have patients with intermittent asthma. Also, you can prescribe WAP, and you may prescribe WAP during your consultation, even during exacerbation if it's not done so previously, and when you prescribe the WAP, you'll be giving the WAP to the patient. So how are you going to know what type of WAP you have given to the patient? So we, in our practice, we do make duplicates of photocopy of the WAP so that you can use it to counsel your patients during subsequent review. Okay, so it's very important if you are given the WAP during an exacerbation, you need to ask the patient to bring back the WAP and you review and revise the WAP if necessary. And even if they are coming in well, you may want to review the medication and see whether you can step down the medications. So use your copy of your WAP to test your patient's understanding as part of your consultation. Okay, very importantly, you must explain the WAP in a step-by-step fashion and then clarify any doubts with your patients. Okay. You may want to reinforce information as part and parcel of your consultation. So check whether they actually understand the WAP. This is very, very critical. And remember to give your WAP to your patient and advise them to keep it in the places where they can be easily retrieved. We have patients that keep the WAP and after a while they forget where they have kept, so it becomes useless. So remember to store in a prominent place so that for easy retrieval. What about patients who cannot read? Okay, this is a difficult practical issue. In our practice, what we do, we give actually colored stickers, purple for serotype, brown for Bicotype, Palmicort, so that they cannot read the word Palmicort, serotype, but they can understand the color of the inhalers. So we stick to that as an alternative and as a visual aid for the patients who cannot read. And ensure that your patient, even if you have written down the WAP, please make sure that they can read your handwriting, very importantly. Okay, if you cannot read, it is again a useless piece of paper. And try to also learn how to prescribe WAP in other languages like Mandarin or Malay. Of course, I put bracket Tamil, I can't do that. So, but many of the patients cannot read English, but they can read Malay, especially our Malay and as well some of the Indian patients. So if you can do that, that would be good. And coming to the details, you may want to write the doses in terms of the number of puffs because they do not understand the actual dosages. So in terms of tablets, but not in terms of milligram, because certain tablets, the doses may vary depending on the brand. And of course, if you are for the persistent asthmatics, if you are considering giving the preventer medication, a single daily dose would be preferable, of course, for adherence consideration. And it is your responsibility to know which age group the drugs are indicated for and ensure that you do not prescribe beyond the maximum dose of controller or preventer drugs allowed. We do encounter patients, very young patients, but are given doses that is actually beyond their age requirement. So this is it is risky to the patient and risky to your career as well. So in summary, WAP is a guide. It is not a recipe. It is not a cookbook. Okay, so it is not a piece of paper that you give to the patient. It is the educational message that accompanies the written asthma action plan, and the patient's understanding of it that is most crucial. So what is in the pipeline? Now we have a lot of gadgets, we have a lot of IT. What about, I understand some of your clinics, you have very good software with e-prescription. Maybe we can interface your WAP with your e-prescription. This is one possibility. How about interactive audio-visual instruction from the MOH website? Sorry, I'm just jumping ahead. But these are things that we should think about with all the technology around, so that you can maybe run through the WAP, how to prescribe WAP in a more interactive fashion. You can see youngsters all downloading from various websites. What about WAP, you see? So can it be downloaded into your handphone, your PDA? And I just understand from John that maybe we also should start educating our young doctors on the use of WAP and should be included in the medical school curriculum. I don't think they have been taught yet. So what can be done now? Okay, these are future dreams. So what can be done now? Please start prescribing WAP to your next asthma patient. Okay, you may be uncomfortable giving WAP in the first few patients, but it gets easier with practice. And you can download the WAP. There's a template readily available from the MOH CPG website. The website is given there. And of course, you can adopt it and adapt it to your clinic use. Give a stamp on maybe the right corner, and the WAP is yours. So you can adapt it for your own personal, for the use of for your patients. So, but just to find out whether you need further training of WAP, if we conduct hands-on practice, will it be useful to you? And let's say if you have, in the interim period, because some people may take time to learn, if you have a team of nurses to assist you in prescribing WAP for your patients, and these are nurses that will be stationed perhaps in a community center, would you send your patients to the nurses for assistance in the interim period? If you take out the piece of feedback form from your paper bag, we would like to hear your views, and if we find that it is useful for all of you to have a hands-on training, we might consider organizing one under the National Asthma Program. So please give us your feedback. We will appreciate your feedback, and pass it to our staff at the registration counter on your way out. If you do not have the copy of the feedback form, I think we'll make some copies available during the tea break. Okay, this template of WAP would not be possible if not for the very wonderful team of nurses in the SNAP program who have contributed bright ideas in the design. So I would like to thank them, and of course to thank Prof. Lim and John for their very great support. Thank you very much.